But first we need to understand how the medical industry works. So I'm going to talk about what I call Medical Industry 101. In its simplest form, healthcare is broken into two segments: primary care medicine and major medical services. Primary care is your family physician, also referred to as your general practitioner. They're the first doctor you contact when you need professional help with an injury or an illness. Primary care medicine goes beyond your family physician to include medical specialists, diagnostic centers such as lab testing and imaging facilities, and it even includes the hospital emergency room. It can fall under the category of primary care. Many medical conditions are diagnosed and treated within the primary care medical system, but when diagnosis calls for treatment outside the scope of primary care, patients move into what we call major medical. It's common for major medical services to involve hospital stays, surgery, sophisticated diagnosis, and treatment. The solution to this is nothing new. It's been around for a long time, and that's what's really cool about this. It just hasn't come to the forefront. So if we understand what causes the problems, let's discuss how consumers get direct access to those services. The tools required to bypass insurance and go directly to the source of your medical care are not new. As a matter of fact, they've been around for decades in the form of telemedicine and what's called medical cost sharing or health share. It's also referred to as health share. The history of telemedicine can be traced back 100 years, but during the past 2 decades, improvements in communications technology, coupled with the relaxation of state regulations that allow doctors to diagnose and treat medical problems remotely, has resulted in telemedicine becoming a consumer product. So it's no longer just talking to a doctor over the telephone. It's now a product that companies have commercialized and sell in the open market. Patients can now have their own dedicated physician that can diagnose and treat over 1,500 conditions over the telephone or in video conferences. Diagnosis and treatment of common medical conditions, you can consult with urgent care doctors on a 24/365 basis and get a response within a 2-hour window, usually less than 30 minutes. Consultations with your dedicated physician, what they call virtual primary care services, can be scheduled within 48 hours. You don't have to wait 2 weeks or 4 weeks to see your doctor. You can be on the phone with your regular doctor within 2 days. With the additional specialists, medical services, mental health consulting, and care navigation services, telemedicine has evolved into what we call telehealth because it provides a wide range of healthcare services. And you can eliminate up to 90% of those inconvenience and expensive trips to the doctor's office by using telehealth services. It's all very available at a low monthly fee. And it's also extremely convenient, obviously. When patients are referred to a medical specialist when your telemedicine doctor refers you to a medical specialist for diagnosis and treatment or for imaging services or lab work, yes, you still have to go see a doctor in person, but patients are connected with those providers on a reduced cash pay price basis. Virtual healthcare services are not only very affordable, you've got 24/365 access to a doctor. The government acceptance of telehealth services within the Medicare and Medicaid programs strengthen credibility. The strong recommendation during the COVID pandemic, where the government was suggesting people go to see their doctor via telemedicine services to avoid contact with other people. And infection has given telehealth a tremendous credibility. So it's very rapidly working its way into the marketplace. Probably wondering, what does major medical look like in next generation healthcare? Virtual primary care services solve the problems of access and cost control for primary care medicine.